When I think about what patient and family engagement means, I really think about patient and family-centered care. Patient and family-centered care is governed by 4 core principles: dignity and respect, information sharing, participation, and collaboration. So information sharing, when I think about that, is making sure that patients know what we know. Participation is making sure that we include them as members of their own care team. And of course, collaboration is a lot of what Qualis is talking about when they're talking about hand hygiene. It's really getting people involved not only in their own care, but in the process of how we deliver care to others. I think patient and family engagement is important in healthcare because if you think about it, every organization, every business usually goes to their end user, and healthcare has been a little bit late to that game. But we're finding increasingly that if we engage patients early in their decision making, that they can make more informed decisions, that they can react quickly when they see mistakes being made, that they can influence some of the decisions in a different kind of way than they might if they weren't aware of what was happening. It's an exciting time right now for patient and family engagement. When we look at the changes that are being made, the Affordable Care Act, for example, what we know about patients is that they actually, when given the chance and given the opportunity, will make more affordable choices than we might make for them. And so that's one of the reasons that it's important to engage them, to give them all the information possible so that they can make a better informed decision. When I was 31, I delivered a baby at 24 weeks. My daughter, it's a great ending. She's 9 years old now. But during her 4 months of intensive care, I had great engagement with the staff. Not only did they engage me as a member of her care team, but they really went the extra mile to show me that they cared about our family and that they really wanted us to have the best outcome possible, even though they didn't know what that would be at the time. What that did for me is that when about 2 months into her stay, when there was actually a medical error that happened, it helped me understand that this wasn't indicative of their care overall, and it helped me understand that not only what did it not mean that I had to be concerned about the care, but I knew that they would work with me to try to figure out how to make sure that that didn't happen again. I do think patient and family engagement is integral to any project, especially when we're looking at quality improvement. The one reason being, if you think about healthcare experiences, who's the one constant? It's not the staff generally, it's the patient. It's the patient, it's perhaps a caregiver or a family member that might accompany them. And so if we don't have them at the table helping us make decisions, we're missing a critical viewpoint. When somebody's thinking about getting started with patient engagement in an inpatient setting, I think one of the most important things to start with is something like daily rounding. Something small that existing staff can handle on their own, something where they can check in on a daily basis with patients and family members, or perhaps a caregiver. It's not always just a family member that's important to a patient. It could be a friend, it could be a partner, it could be a coworker that's accompanying them during their care. And so it's important to get perspective from everybody involved. But something like daily rounding can get people just familiar with getting patient input in a way that maybe is a little bit less intimidating than, say, starting a patient family advisory council. Using patient and family advisory councils is a great idea when you're looking to make any kind of improvement in healthcare for a couple of reasons. One is they usually engage both patients and families and staff. So you get not only the input from patients and families who can say this is what we'd like it to look like and this is what we've experienced, but you also get that staff point of view that can say this is what we've tried before, this is what worked and what didn't work, and here are the resources that we have to work with. And having those 2 points of view is really key when you're looking to make any kind of quality change. I think a lot of staff wonder if we're going to have time to do patient and family engagement. If you can imagine a nurse, a floor nurse perhaps, that's stressed out or perhaps has too much on her plate, this can seem like just one other thing to add to a long list of things that she has to do during the day. But what we found is that if you engage patients, not only can you put people back in touch with why they went into this work, but they can actually find valuable tools that patients will give them in terms of getting their work done in a more efficient way.